So doctor, what is the cause of blood in stools? Isn't it always piles?
Yes, all rectal bleeding is not piles. Rectal bleeding is a common symptom which creates anxiety, and it is commonly assumed as bleeding due to piles. Assuming bleeding is due to piles can be dangerous. It needs to be evaluated before labeling it as a piles. So most of the times the rectal bleedings are due to benign conditions, and after evaluation the benign condition which causes rectal bleedings could be hemorrhoids, that is piles, fissure, fistula or anal abscesses. One should also keep in the mind there are other causes which can also cause the rectal bleeding, like colonic cancers, diverticulitis, Crohn's disease, angiodysplasia. Many a times the patient's complaints and the history, like the color of the bleeding, can lead us to the initial site of the bleeding. Like if it is a bright red, that can be due to the anorectal cause of bleeding like fissure or piles. If it is a brownish red, then that could be due to the colonic or small intestinal bleeding. Sometimes the stools can be the black colored. That suggests it could be the upper GI bleeding related cause. Most of the times could be the peptic ulcers. So depending on your initial clinical diagnosis, your doctor may suggest you a proctoscopy, proctosigmoidoscopy, colonoscopy or upper GI scopy to find the pathology or the site of the bleeding. And depending on the findings during colonoscopy or upper GI scopy, your doctor may take the biopsies from the suspicious sites like ulcers, polyps or any other pathology. So don't be panicked if you are suffering from rectal bleeding, that is if you are passing blood in the stool. Get it evaluated by your doctor immediately, and most of the times these conditions are treatable and curable as well. So rectal bleeding is a symptom and not a disease. Or all rectal bleeding is not due to piles. Piles is the one of the common cause but not the only cause. Get it evaluated early. Early diagnosis can save lives. Treat the diagnosis and not the assumption.